Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
You have said
you're asking me, Senator, you're asking me not to sue vaccine pharmaceutical companies. Yeah, you are. That's exactly what you're doing. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know anybody with a food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all of these things that are related to toxics in the environment? Why can't we just agree with each other? Senator, I can't give you a yes or no answer to that question.
Healthcare a human right? Is healthcare a human right?
In the way that free speech is a human right,
yeah.
I would say it's different because with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool. Well, and so are you guaranteed the same right, or is there also a duty?
I'm sorry, I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, to human right.
We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugar drinks. So we have a direct ability to change things there.
Are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this, he asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective, and I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right, so
he interrupted me at that point. I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
We need to move on.
This is not just a economic issue. It's not just a national security issue. It is a spiritual issue, and it is a moral issue. We cannot live up to our role as an exemplary nation, as a moral authority around the world, and we're writing off an entire generation of kids.
Thank you very much. And if confirmed, how could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
Do you think physicians, when they make that prescription, ought to have access to good science?
Of course they do. And
That's all I believe, too. And you and I are in agreement, Senator.
And to your point that you made when you made these statements, it was not based on good science. I don't know what it was based on.
I was saying the science needed to be done. I was saying these are potential culprits. We're coterminous, and I named other things. I said video games. I said social media. I said SSRIs. SSRIs have a black box warning of suicidal, homicidal behavior.
Mr. Chair, I will submit to the chair the information that I have about what Mr. Kennedy has said of linking antidepressants to school shootings.
For 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially. The United States has worse health than any other developed nation, yet we spend more on health care, at least double, and in some cases triple, as other countries. The Trump administration has made clear that it does not want to freeze benefits for any Americans under Medicaid or Medicare, and I do not want to dismantle Medicaid.
The freeze is affecting beyond Medicare and Social Security.
I'm an implacable enemy of tyrannical, insensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health plan, and it is the template for what we ought to be doing. It's a value-based plan, and I look forward to you to making sure that we create pilot programs like this.
I'd like you to
Purposeful
explain,
policy.
excuse me, sir, I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down, where those battered women to go. Or a rural nonprofit I've got in the Shenandoah Valley who's saying that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending out, you don't know if you raised a lot of money Monday night.
I'm saying that the Trump administration
You don't know if you raised a lot of money.
The Trump administration has made clear that it does not want to freeze benefits for any Americans under Medicaid or Medicare, and I do not want to dismantle Medicaid.
The freeze is